The most common is certainly what they term the garden variety osteoarthritis, or quote, wear and tear. It refers to just deterioration of the joint, or the articular cartilage or the coating cartilage on the ball and socket joint deteriorates or thins to the point where you get the quote, bone on bone condition. With this, bone spurs are formed and often leads to that stiffness condition that goes along with the pain and the grinding. Secondly, rheumatoid arthritis, which is more of an inflammatory condition where the body essentially almost attacks itself. It's referred to as an autoimmune disease. This works a little bit differently, where the lining of the joint or the synovium gets inflamed and then produces enzymes that lead to the deterioration of the joint. Some of those patients also will get stiffness, but their arthritis pattern's a little different, but same kind of results and symptoms can occur, certainly. Another type of arthritis is post-traumatic arthritis, meaning after a fall or an injury. Sometimes it can be associated with a fracture or a broken bone around the shoulder, primarily what we term the proximal humerus. Sometimes those fractures can injure the blood supply to the humeral head or the ball part of the joint and result in deterioration over time, where that can develop arthritis in the patient, sometimes relatively quickly, and then sometimes more, over years or decades even. Another type of arthritis we see is associated with different blood flow problem called avascular necrosis. The blood supply to the humeral head specifically can be disrupted. Again, can happen after trauma. Certain conditions such as sickle cell disease, lupus, in some cases patients with alcohol abuse or excessive use. Also in rare cases, people that dive or scuba dive. What happens is the blood supply is disrupted to the head, the bone cells die, and then the head ultimately collapses. So it can start on the humeral side or the ball side, and then ultimately can affect the socket if the disease progresses or advances enough. The last type of arthritis we term rotator cuff tear arthropathy. Certainly rotator cuff tears, as we commented on earlier, is very prevalent. Larger tears can actually disrupt the function of the shoulder, the ball and socket joint, enough to where the head will migrate superiorly. That superior rotator cuff is not depressing the head, if you will. And as the head migrates, it can change the mechanics of the shoulder enough to where the patients can't elevate their arm and they may do this instead of this. And that's termed rotator cuff tear arthropathy, to the point where the joint can also be involved. Cartilage can deteriorate and even kind of wear the joint asymmetrically to the point where the patient can develop arthritis as well. This is treated a little bit different sometimes than classic shoulder arthritis, which we can get into later.